Good afternoon, Namibia and the world, and welcome once again to another session here at the Government Information Center. Now, as a country over the past few months, we have been able to loosen public health restrictions due to a tremendous decline in positive cases, ICU admissions, and near zero deaths have been recorded due to COVID-19. Measures were relaxed in the interest of livelihoods and economic recovery, with the understanding that the Namibian public would heed the advice of the government to continue exercising the preventative measures taking up the call of voluntary vaccination to mitigate the spread of COVID-19. But in recent days, the country has observed a sharp increase in the number of new cases, including reinfections. The question that is being asked by the public is, are we entering into another wave of COVID-19? In the studio this afternoon, I am joined by three experts who are here to address the very simple topic that we have this afternoon. Are we entering into another wave of COVID-19? We have Ms. Catherine Walter-Savio. She is the Public Health Preparedness Advisor with the Center for Disease Control, the CDC. Good afternoon, ma'am. Thank you for being with us.
Good afternoon. Thank you for the invitation.
We also have Dr. Akpabli James, and he is the incident manager with the World Health Organization, WHO. Good afternoon, doctor. And we also have Ms. Emmy Elsa Ndivaitela, who is the surveillance lead for the Ministry of Health and Social Services. Good afternoon, ma'am, and thank you for being with us.
Good afternoon. Thank you for having me.
And we start straight with Ms. Ndivaitela. Last week, Namibia observed this sharp increase in the number of new COVID-19 cases. Could you please give us an overview of the current status of the COVID-19 in the country?
Thank you very much. As you rightfully indicated, we started observing the increase in the number of confirmed cases. We have come a long way with this situation now. Of course, we know we started with COVID since 2020. So we have tested more than 1 million people, and of which we have recorded more than 160,000 confirmed cases. Of course, we started recording the reinfections, and most of them we are having the new infections. The situation is really worrisome now that we're seeing the number doubling up. For some weeks, our numbers of confirmed cases which had been reporting had been in the range of 2 digits. Now we are seeing consistently 3 digits. Most of cases are reported from Windhoek, Commerce region. More worrying that what was reported yesterday by the statistic of the 17, that figure has even been doubled by what we have recorded with the statistic of the 18. It's quite a worrisome situation. The number of hospitalization started picking up. For some weeks or some months, we had been recording 0 admission due to COVID-19, but the situation started changing. As we know, we are having now increased number of people getting admitted. I think by now we have more than 60 people across the country who are being hospitalized. Those who are also getting in the severe state or critical stage, getting into critical care unit, ICU, they are also picking up slowly. Of concern, still a higher proportion of the confirmed cases, of those requiring admission, those getting into ICU, and unfortunately those who are dying, mostly are unvaccinated. Our vaccination coverage is still less than 30% coverage of the target which we have, which is really far low compared to the desired percentage of about 80% coverage if we are to talk of herd immunity, where you can say even though the few who will remain unvaccinated will in a way indirectly being protected. We are very far from that. So though we have seen a few number of life being lost, of course, one life lost is just too many. So we really want to caution the nation that we should keep adhering to our preventative measures. We should still go for vaccination. We know we might not avert all the infections because some people are saying, I am vaccinated, but I still get infected. But as we are saying, vaccination will help you not to get into the severe state and mostly will prevent one also from dying. So we might not prevent infections, but at least let's avoid getting into the severe state and let's avoid as many unavoidable deaths as possible.
Definitely a call there to be heeded by the country. We don't want to be back where we were last year this time. It hit the country hard. For a small population, it touches you, where everybody knows somebody who has passed on because of COVID. So it's a very good call from our health sector that is saying, please, we've relaxed because we're concerned about the economy and livelihoods, but the health factor still remains that we need to take care of each other. Dr. James, from the World Health Organization's perspective, what can we point to as the contributing factors to the increased number of COVID-19 cases that the country is recording, particularly from last week?
Okay, thank you very much. First of all, I just want to say that there are several factors that contribute to the cases that we are seeing currently. And we all know that when the government relaxed the public health measures, it actually gave room for us to come to some level of normalcy. And people need to now come back and say, what can they do differently to ensure that we don't have this increased number of cases? One factor has been the public health measures. That's the use of masks and social distancing or physical distancing, and also the need for us to also avoid going to participate in gatherings and meetings that give the conditions for people who are carrying the virus to transmit to others. The masking has been a very key challenge because currently, as we all observe, because of the realization, a lot of people go out who are not carrying with them their mask, who are not also trying to make sure that even if they are coughing or they are sick, they avoid gatherings. And then the biggest factor to me is the vaccination, as has been mentioned by Ms. Amy. The vaccination levels are so low that anybody who has not been infected before, who is not vaccinated, is likely to get the infection because they are susceptible. There are a lot of people who are still susceptible, especially the younger ages, and because they can be infected easily, they are likely to spread it if once they mix with the rest of us. So the other aspects of all this is we need to find a way of balancing public health measures with our livelihood and economy issues. And sometimes finding the middle ground is difficult. So we think that because behaviors takes time to change, we need to start looking at the public health measures and try to tighten them a little so that certain activities can go on whilst we prevent the infection from spreading around. But I think the vaccination is one thing that can easily be done if people are convinced, if people are educated, if people, educated to go for the vaccination. So it's not just a matter of going for telling them to go for the vaccination, but explain the benefits of also going for the vaccination. And I think that is one area that we need to look at and make sure that we do more than we are doing to increase the vaccination rate. The other factor, obviously, is the weather, which, because of the winter that is almost here with us, we tend to gather and try to be in close spaces. And that, if somebody is carrying the virus, the person is likely to also transmit the virus easily to others. And the winter season comes with it, the flu also as well. Sometimes we think that we can handle COVID like flu. No, flu has been with us for several years, and still we get it.
Yeah.
But we know that we have learned a lot about flu. But when it comes to this virus, COVID virus, it becomes very, very difficult. So we need to continuously observe these public health measures as we are talking about for some time to come. When we get used to it and the body is now able to know it better, then it can react better, and then we can all say, okay, we are used to it. But I don't think we've reached that stage yet. So we need to also look at some of these public measures, especially this time, and make sure that we can implement them.
Okay. Well said. It's a health issue. It's an issue that we would like to welcome your voice to the show, where you can add or state maybe your experiences or ask a question to the panelists if you have any questions. You can find us on our social media platforms, on Facebook, where we are live streaming from as well. Our handle there is Ministry of Information and Communication Technology, Republic of Namibia. That's on Facebook, Ministry of Information and Communication Technology, Republic of Namibia. On YouTube, we are also live streaming on that platform, and our handle there is MICT Namibia, MICT Namibia. Please drop us your comments, your questions, if you have any. Ms. Walter Savio, we would like to find out, given the fact that we have started to observe upward trends in the epidemiological trajectory, from the Center for Disease Control and Prevention perspective, what must be done as a matter of urgency to avoid increased number of the new daily infections?
Thank you very much for that question. As Dr. James mentioned, it is crucial that we wear well-fitting masks that cover both the nose and the mouth, especially in environments where there are large numbers of other people. It's also important that we carefully consider which social gatherings or mass gatherings we decide to attend. For instance, a mass gathering of several hundred people in an enclosed environment where there's minimal ventilation and people are not wearing masks will pose a higher risk for COVID transmission and infection, rather than a gathering of just friends and family where you're all outside and the wind is blowing and there's just less risk of transmission in that sort of setting. So gatherings are not all created equal in terms of transmission potential. So we just need to be careful about which gatherings we choose to attend and what sort of measures are in place to prevent transmission in those situations. It's also important to, at this point, COVID-19 infection and the common cold are virtually indistinguishable. And if you're having cold symptoms or flu-like symptoms, it's important to get yourself tested so that you're able to take the appropriate measures to protect others, like your friends and family, your coworkers, from infection. And also vaccination. Once again, we keep coming back to this topic, but it's just so important. Vaccination is a proven, it's been proven safe and effective, and it's the best way that we have to protect against severe disease and death, and it's the main tool in our that we have to protect our loved ones as well. Thank you.
Okay. Reminders that you're welcome to join this conversation. Our lines are open, and the number there is 061 400 397. 061 is the area code for the Commerce region, and the number is 400 397. Ms. Ndevaitela, in the same vein, should we say the current upsurge in the number of new cases that we are observing are being driven by the Omicron variant that we saw driving the previous wave, or is it a different variant? And is it actually safe to state that Namibia is currently entering or in the fifth wave of COVID?
Thank you very much for that question. Of course, we know we have already experienced previous 4 waves. These have learned or given us now the understanding how COVID-19 sort of behave. So the first wave we're experiencing around April, May 2020, third wave setting around December. Then we have the devastating third wave which we experienced, which started almost around this time last year, which went up to July, August. That was the worst of all, which was driven by the Delta variant.
Yeah.
When it went down, we have observed the fourth wave around December, which was driven by the Omicron variant. So far, we still have evidence that Omicron variant is the one which is driving our infections here, with our last genomic sequencing report pointing to or confirming the existence of the Omicron subvariant, which is called BA.4, because we know we have different subvariants, but they are all Omicron variants. So probably that's why we are seeing, as much as we are seeing the surge in the number of cases, is quite low compared to what we had same time last year. So, of course, this is to confirm, as we have indicated, that our infections are still driven by the Omicron subvariants. We had so far observed or confirmed 3 in the country. In neighboring countries, they have also confirmed BA.5. That one we have not yet confirmed in Namibia. Now to the question of the fourth wave. You know, when you go out of the wave, like now when the cases dropped after the fourth wave from December, January, when we were even reporting single digits, we picked up to go to 2 digits. And as I said, now we are reporting 3 digits. We follow international guidelines which set threshold. WHO have set a threshold of a resurgence. How do we explain the resurgence of new cases? So when we look at the cases in the last 2 weeks or so, when we see that our cases are going more than 20%, increasing by more than 20% of what we had been reporting in the last 2 weeks, that means we start resurging. I have just indicated that just in the matter of 2 days, our figures doubled. This is clear indication that we are setting in the 5th wave. It might not be as worse as the one we have experienced before, given the different factors. Of course, we have, though our vaccination level is not up to the desired level, but of course it's obvious it's a different figure compared to where we were last year, same time. And also the fact that the variant which is driving the infections this time, the Omicron, we have observed that it seems not to be causing more severe cases, as compared to the Delta variant, which we dealt with last year. But we know with these variants, they keep mutating.
Yeah.
You don't know when you are expecting a new variant to come up. It could be still a new sub-variant of Omicron or a totally new variant, which might be bad in terms of severity.
Yeah.
So we need to do all what we can to make sure that we remain vigilant and in control of the transmission. And we cannot overemphasize the measures which had already been mentioned. Of course, coupled with the winter season which is starting, we know there are lots of viral infections and flu-like symptoms or illnesses, and also other influenza illnesses which usually occur during winter period. So the best is for us to increase the detection rate of COVID-19 so that we cut the transmission. So whenever we have symptoms of flu-like symptoms, it's not just safe to say it might be just a normal flu, because a flu season, as Catherine have indicated, is best to go out and get tested and know where you stand, because that will help you to know how you behave. You know, if this is COVID, then I need to at least isolate myself from others, to stop engaging more with others. Even now, as we are saying, the masking is not mandatory. This is now the time when you need to keep on at least applying all the preventative measures. To say the mask is not mandatory is not to say it's not effective any longer, but it's more to give the ball in the public hands that we have the responsibility to take our health into our own hands. So we need to do what is right.
Okay.
Thank you.
Okay. We have a comment from our social media platforms, and this particular one we are getting from Ria van der Merwe. Ria van der Merwe is stating that you cannot vaccinate during the peak time. I think I will convert this into a question to the panelists. Maybe they can help us to explain the times of vaccination, because Ria is stating that you cannot vaccinate during the peak time. And then we have a second one here from Richard Kambinda, who is saying, is there a difference between the common colds versus COVID-19 versus seasonal influenza? So those are three types of, should I say, illnesses, diseases that he's trying to gain clarity of the difference between them. So anybody is open to help us with those two. When is it safe to vaccinate? Because Ria is stating that you cannot vaccinate during peak time. I think we should then turn it around and create a question out of it to just create that education for somebody out there, as in when is it then the best time? What is peak time and when is it best time to vaccinate?
Okay. I would say it's a decision of an individual to know whether they are infected or not, first of all.
Okay.
If you know you're not infected and you haven't been vaccinated, then you can go for the vaccination.
Okay.
Yeah, so those who are giving the vaccine are there to make sure that they ask those questions before they give you the vaccine. So it is not like a general rule that because we are in the peak season, then we stop vaccination. No. Okay. It's an individual decision. Once you are, for example, I'm not infected at this moment, I can go for my vaccination.
Okay.
But if I'm infected and I know I'm sick, there's no need for me to go for the vaccination.
So when we are referring to the peak time is more with regards to infection and non-infection.
Non-infection, yeah.
So does it also then refer to when you have a flu?
Good question. Sometimes, that's why we are saying at this time we have asked the person who asked the question, define it. We have the common cold, we have the influenza, and then we have COVID now. So it's better you get your test.
Mm-hmm.
If you feel ill, go and get yourself tested for COVID. And if it's not COVID, there is likelihood that it is a flu. Then you will be given the necessary treatment.
Okay.
Yeah.
And then Richard was asking that definition. I think it will also assist the public. What is the difference?
Well, to an ordinary person, the difference, there's not much difference.
Okay.
But we look, if you look at the symptoms, there is some slight differences. There are some slight differences that the clinicians look for when they are asking the necessary questions. For example, in terms of the cough, yeah, we know that with COVID it is dry and heavy. Yeah, and then I think when it comes to the sore throat and everything, they are all the same, more or less. Yeah, but we know that the tiredness, the breathlessness, and all those things comes later on with COVID. But we don't want you to wait till you start experiencing that. That's why when you start seeing the earlier symptoms, which is the runny nose and the cough, you better go and get yourself tested. But it's very difficult ordinarily to say this is the one and this is cold and this is COVID. The other aspect of it is who did you get it from? If the person tested and he was COVID, or he or she was COVID positive, and you also got common cold-like symptoms, then it's likely you're also having COVID.
Okay.
Yeah. So it's very important to also know who you have been in contact with and who you likely might have got the cold symptoms from.
So it's to keep track of the movements that you have.
Exactly.
And what do they call it? What would we call it? Like a personal contact tracing type of practice that we need to adopt.
Yeah, it helps us in the contact tracing also, so we know who might have got given you the infection, and then we can get that person to also get tested on those.
Okay. Silas from Windhoek is calling us. Good afternoon, Silas. How are you?
Good afternoon. How are you doing?
No, we are well. We are well. Welcome to our show this afternoon. How would you like to contribute?
A few questions I have. First of all, you talked about COVID vaccine and the COVID regulated of what for mask. For my own advice for people who are not able to use the mask for now, is that first of all we need to understand that we are in a winter time, and after winter time we have what we call disasters of a lot of pollution, airborne, whatever it's called, in the different areas, whatever we find ourselves. So it is better for now those who are on authority to advise people for taking care of putting masks. For now, it's not by mass, but just for encouragement. Let us not make it like an obligation, because when you make it obligation, because now we are convincing the whole system that we are saying masks is for free. It's free now, you don't need to use masks. But just for your safety and for other safety for other people. Now coming to the vaccine, I'm not encouraging nobody to take vaccine, because the reason is the vaccine, those the WHO or the disease center are not correctly giving the correct vaccine that human beings are supposed to be taking. And we are asking, when is this real vaccine is going to come? When is the scientists that they are waiting for to give the correct vaccine for people to take vaccine? If not, then nobody must be helped others to take vaccine. If those who already take vaccine, we see them, they are dying and they are being sick. So that way, it's much better for people to just keep away from the vaccine for now, because vaccines have been expired over all other countries. People are spending money, governments are spending money, but yet they are losing their money. Because of why? Their citizens are not also want to take vaccine. So my own opinion is, or advice is, let us just encourage people for now, take your system very seriously, and protect your interest of yourself to use a mask all the hand wherever you are. That is the way I can say thank you very much, Madam, for your time. Because it's too short. I have many things to say.
Okay.
But because of time.
Thank you very much, Silas, for your
Thank you.
contribution.
Have a blessed day.
Have a blessed day as well.
Okay.
I think with the first part of that, with regards to, Silas mentioned WHO, CDC, with regards to the vaccination. And I don't even know how to state it. Should we say, did he say incorrect vaccine? I don't know.
Well, I didn't get that part very well, but I think it was to negate the effectiveness of the
vaccine.
The vaccine.
Okay, because he mentioned people who are vaccinated who are also dying from various illnesses as well as the COVID-19. I would want Ms. Walter Savio, maybe you can comment on that one. And in the same breath, he spoke about vaccines that are expiring, and that would bring me to my next question that I would have for Ms. De Vitella.
All right, thank you very much, Silas, for the question. All of the vaccines that are available for COVID-19 in Namibia have received emergency use authorization from the WHO. So that is to say that they have been proven safe and effective against severe COVID-19 infection. Yes, there have been some people who have been fully vaccinated who have died of COVID infection. However, the mortality rate, or the number of people that have died who are fully vaccinated, is far, far lower than the number of unvaccinated people who have died of severe COVID disease. And as Ms. Emmy mentioned at the beginning, the people that are in the hospitals, in the ICUs, requiring additional oxygen and ventilation, they, for the most part, have not been vaccinated. And a lot of people, those that have died after they've received full COVID-19 vaccination, they have severe comorbidities that just would ultimately decrease their chances of survival. So it is not fair to say that those that have been vaccinated against COVID-19 are dying, because they simply aren't at the same rate as the unvaccinated population.
Okay. Ms., we have run out of time, but I would like to pose this question to Ms. De Vitella in the shortest period possible in the interest of time. Recently, it was reported by the media that around $26 million worth of COVID-19 vaccines are to be destroyed due to expiration. This is to be the second batch of COVID-19 vaccines to be destroyed since the outbreak of the virus in Namibia. What has the ministry put in place to ensure that this expensive exercise is mitigated?
Thank you very much. This really comes back to the call which we are always making to the public, that we need to make use of these critical resources which we have, the vaccines. It's unfortunate that at the beginning of the vaccination stages, we had been running short of acquiring the vaccines because of the challenge in the logistics system.
Yeah.
It's unfortunate that quite often the vaccines we receive, they have a short lifespan.
Okay.
Like they come, but they are expiring within like the next 3 months.
Yeah.
So as we are saying, the vaccination is not mandatory, but we are encouraging people. We are really calling upon the nation to make use of these resources available. Okay. Because, of course, we cannot say if it's there, it's money, even if it's passed beyond the expiry date, we have to use them. No, we cannot. So we have to use the potent vaccines before they expire. Okay. But if they expire, it's unfortunate, they have to be destroyed.
Okay. But now, in the interest of trying to mitigate the problem of money wasted, because obviously we have seen the trend, fewer vaccinations? Has the ministry maybe cut down on the number of vaccines that they're ordering?
Yeah, of course, even in today's discussion, that was emphasized that we are holding on the number of the vaccines which we are receiving.
Okay.
Because we had been procuring as a nation, but we have also been receiving some donations. So all those we are prioritizing now, especially also looking at which type of vaccine is mainly being used.
Okay.
So those are the measures which the team had put in place
Okay.
in making sure that it's
As I
being
stated, that time is not always on our side, but as we are wrapping up our show for this afternoon, we also have a message that is dedicated to the healthcare workers to take action and lead by example. And these are two messages that are coming from Dr. Uirap as well as our Deputy Minister of Health.
I want to remind you again that it is confirmed everywhere in the world that COVID-19 vaccines are safe, they are efficacious, and they have saved so many lives. They have removed the need for hospitalizations and ICU treatment for many, many hundreds of thousands of people all over the world. Health workers are supposed to lead by example. And I want to say that the current vaccine hesitancy that we see in Namibia today could probably partly be ascribed to the fact that health workers are themselves not vaccinating in the numbers that are required. I want to also remind you that because we are the ones who receive and treat people who are ill, we are probably the most exposed section of the community to COVID-19. And if we do not protect ourselves by vaccinating, we are exposing ourselves unnecessarily to risks of COVID infection. I want to therefore urge all health workers all over Namibia, and especially those at my own hospital, the Windhoek Central Hospital, to please go ahead and vaccinate. We have the vaccination site right at the hospital, and yet I'm aware that quite a good number of our health workers are not vaccinated. This does not augur well for our profession as healthcare workers, as we are supposed to lead by example, as I said earlier. I also want to say that as we had last year, come winter, we may again see a very high spike in admissions to hospital of patients with COVID-19, and that will mean that again we will be much more exposed as health workers. So my call on everyone who is a healthcare worker, and when I say healthcare worker, I do not only mean doctors and nurses. I mean everybody who works in the healthcare setting, from cleaners, porters, and everybody. We need to vaccinate, we need to protect ourselves, we need to protect our loved ones. Thank you very much.
Thank you very much for that message there from Dr. Uirap, who is definitely sharing the sentiments from people or all people in the health sector, calling for the health workers to please take care of themselves as we need them to take care of the nation. With that said, we have come to the end of our show. Thank you for the panelists for availing their time to be with us this afternoon. From myself, Shianua Desire Kahiha, along with my production crew, have a good afternoon until Monday. Same time, same place.